Cultural conflict is a type of conflict that occurs when different cultural values and beliefs clash. One which can be seen are the contrasting views on COVID-19 vaccines. While most agree that it is indeed compulsory to take vaccines, some may argue that it is contrary to their beliefs and refuse to take them. It's a known fact that the pandemic had caused tremendous losses to the country, not only in the monetary forms, but also caused thousands of lives to be lost. The government of Malaysia has since then enforced multiple measures to prevent the spread of COVID-19, but to no avail. The issue comes down to what impacts had these anti-vacciners caused.
The digital vaccination certificate has become a hot commodity in Malaysia, as the fully vaccinated are allowed greater liberties and social perks. The first issue here is that irresponsible unvaccinated individuals who have made attempts to lie about their vaccination status with fraudulent certificates. It is reported that private clinics have been getting inquiries from those who are unvaccinated to fake their vaccination status with offers up to 1,000 ringgit. The reason this issue occurred is that there are report findings that vaccines from various countries have side effects and even worse, may lead to death. Many people get confused about the process of vaccination and are feared to take vaccines. Hence, many false rumors appear and spread wide in social media to brainwash netizens not to take vaccines but obtain a fake digital certificate.
Like many other countries, Malaysia has small but vocal groups opposed to COVID-19 vaccines. Thanks to social media, it is now easier for anti-vax to find one another. For instance, on Telegram, a simple search using phrases such as anti-vaccine results in a number of groups discussing such matter. Participants in such groups typically share information on alternative medicines, suspicions over the vaccine's long-term effects, while others purported that it was against their religion to be vaccinated. In Malaysia, most of the doubts on vaccine arise regarding the content of the vaccines. There is also a belief that if other people have received the vaccination, then the anti-vax community no longer need one. There were also posters in the Telegram group encouraging their family and friends to not receive their vaccine and take note of the advice as an act of love and care.
It is a known fact that fake digital certificates are a clear violation of the law, and those found guilty of such crimes are liable to be fined up to 100,000 ringgit and a maximum imprisonment up to 7 years, as provided in Section 22, Subsection D of the Prevention and Control of Infectious Disease Act. The penalty should be increased and extended to other forms of punishment, including having their passport confiscated and imprisonment for individuals found forging vaccination certificates of vaccinated individuals and manipulating it for their own use.
Solution for the second issue is governments and authorities in charge can organize small campaigns to spread awareness about the benefits and importance of taking COVID-19 vaccines. Common knowledge about how vaccines works and their effectiveness should also be published on social media to encourage citizens to take their vaccinations. It should be clear that vaccines are meant to tackle the pandemic, but anti-vaxxers lack the understanding on the benefits of vaccines but instead blinded their own judgments by just looking at the possible negative effects. Advantages and disadvantages have to be weighed, hence the government has to inculcate the importance of taking vaccinations to the public so they would take them more willingly.
Laws also play a significant role in this. Section 233 of Communication and Multimedia Act specifically makes transmitting false information a criminal offence. Meanwhile, health facilities should advise those wanting to buy a fake digital vaccination certificate to take proper vaccination instead of buying a fake one. In conclusion, the Malaysian government and netizens should work hard and cooperate with each other to achieve a full vaccination rate for a better future for Malaysia.